It happens without any warning at all. You're asleep, or almost asleep, and suddenly your calf locks into a hard, painful knot. You sit up quickly in the dark, grab your leg, try hard to stretch it out, and for a few seconds it feels like the muscle simply will not let go. Once it finally passes and releases, you tell yourself it was just a cramp, just something that happens as you get older. But if this keeps happening, night after night, that explanation is only part of the story. If you are having leg cramps at night more than occasionally, if they are strong enough to wake you up, or if you find yourself almost bracing for them before you fall asleep, that pattern deserves a closer look. It is common. It is also, in many cases, a sign that something specific and identifiable is going on, something that most people never think to mention to a doctor because they assume there is nothing to investigate. Before we go further, if you want health information explained in plain language, without panic and without sugarcoating, subscribe to Dr. Michael Carter and tap like. This channel is built for adults over 50 who want to understand what is actually happening inside their bodies. And before we continue, write your city or country in the comments. It helps us understand where this message is reaching. Now let's talk about why this happens, because the explanation most people believe is usually incomplete. Most people assume leg cramps are simply caused by low potassium or not drinking enough water and stop their investigation right there. Sometimes that is part of the picture, but clinical research shows nocturnal leg cramps affect a striking number of older adults. Some studies estimate that nearly every adult over 50 will experience one at some point, and roughly a third of adults over 60 will have one at least every couple of months. That is not a rare inconvenience. That is one of the most common nighttime complaints doctors hear from older patients, and yet it remains one of the least explained. Here is the reversal. A nighttime leg cramp is not simply a muscle acting up. It is an involuntary, forceful contraction that your muscle cannot immediately release, and in most cases, it is being triggered by a specific combination of changes happening in your muscles, your nerves, your hydration status, or your medications. The cramp itself is just the visible event. The real explanation is almost always something quieter, happening underneath it. Let's start with the most basic, physical explanation, because it explains why this becomes so much more common specifically with age. Your tendons. Tendons are the tissue that connects your muscles to your bones, and as you age, they naturally shorten and become slightly less flexible. Shorter, stiffer tendons place your calf muscles in a position where they are more prone to sudden, forceful contractions, especially when your leg has been in one position for a long time, like during sleep. This is one of the simplest reasons cramps become dramatically more common after 50, and by itself, it is not dangerous. It is simply a mechanical change in how your muscles and connective tissue behave. This is where the story usually gets more serious, so listen carefully. And remember, this is medical education, not a diagnosis. Here is what most people never connect. Being sedentary during the day is one of the strongest known risk factors for nighttime leg cramps, and the connection is almost the opposite of what most people assume. People often think inactivity should reduce muscle strain and therefore reduce cramping. But research following older adults found that a sedentary lifestyle was associated with a dramatically higher risk of nocturnal leg cramps, even after accounting for other factors. When your calf muscles do not move much during the day, circulation slows, muscle fibers can become fatigued in unusual ways, and the nerves controlling those muscles can become more prone to misfiring at night. A short walk, or even just moving your legs regularly throughout the day, appears to meaningfully reduce this risk. Dehydration and electrolyte imbalance are the causes most people have already heard of, but the details matter more than the gene. RAL idea. Sodium, potassium, calcium, and magnesium all play a role in how your muscles contract and relax. When these are out of balance, whether from not drinking enough fluid, from certain medications, or from an underlying kidney or metabolic condition, your muscles can become more prone to firing when they should not. Thoughtful. This is part of why cramps become more common in hot weather, during illness with vomiting or diarrhea, or in anyone taking medications that affect fluid balance. Nerve changes are another piece most people never hear about. As you age, the nerve cells that stimulate your muscles can begin to function slightly less efficiently. Some researchers believe this contributes directly to nocturnal cramps because these aging nerve endings may misfire more easily during the deep relaxation of sleep, sending a contraction signal to the muscle when none was actually needed. This is a genuine, measurable part of the aging nervous system, and while it cannot currently be reversed, understanding it changes how you think about the cramp itself. Exhales. It is not a random punishment. It is a specific, identifiable nerve and muscle interaction. Medications deserve their own careful mention here, because this is one of the most overlooked and most fixable pieces of this puzzle. Diuretics, often called water pills, are frequently prescribed for blood pressure or heart conditions, and they can deplete potassium and magnesium, directly increasing cramp risk. Statins, used to lower cholesterol, have been associated with muscle cramps and muscle pain in some people. Certain asthma and blood pressure medications have also been linked to increased cramping in some studies. None of this means you should stop or change any medication on your own. That decision always belongs to your doctor. But it is completely reasonable and often very productive to ask your doctor directly whether any medication you are taking could be contributing to your leg cramps. There is also a smaller group of underlying conditions worth knowing about, not to cause alarm, but because identifying them can meaningfully improve treatment. Hypothyroidism, an underactive thyroid, has been linked to increased muscle cramping. Kidney disease can disrupt the electrolyte balance that muscles depend on. Diabetes-related nerve damage, called peripheral neuropathy, can contribute to abnormal muscle signaling in the legs and feet. Concerned. And certain neurological conditions, while much less common, can also present with increased muscle cramping, which is part of why persistent, unexplained cramps that do not improve with basic lifestyle changes deserve a real medical evaluation rather than indefinite home management. Before we go to the next part, tap like if this explanation is making the pattern clearer for you. Encouraging. It helps this video reach more older adults who may be dismissing the exact same signal as simply getting older. Now let's talk about something important, telling a true nighttime leg cramp apart from two other conditions that are frequently confused with it, because the distinction genuinely matters for how you and your doctor approach it. Restless leg syndrome causes an uncomfortable, often hard-to-describe sensation deep in the legs, along with a strong urge to move them, usually in the evening or at rest, and it is relieved specifically by movement. It is generally not a sharp, painful muscle contraction, the way a true cramp is. If your main complaint is an urge to move your legs, rather than a locked, painful muscle, that distinction is worth mentioning to your doctor by name. Claudication is different again. It is a cramping or aching pain that occurs specifically during walking or activity, caused by reduced blood flow through narrowed arteries, and it typically eases within a few minutes of rest. If your leg pain consistently shows up during activity, rather than waking you from sleep, that pattern points toward your circulation and arteries rather than a simple muscle cramp, and deserves its own dedicated evaluation. Now let's talk about what you can actually observe, because this is where the video becomes practical. First, notice the timing and pattern. Is the cramp happening specifically at night, in the calf, and lasting seconds to a few minutes, with soreness afterward? That classic pattern is consistent with an ordinary nocturnal leg cramp. Cramps that happen primarily during exercise or walking point towards something different and deserve their own conversation with a doctor. Second, pay attention to frequency. An occasional cramp, once every few weeks, especially after unusual activity or heat exposure, is common and usually not concerning. Cramps that happen several nights a week, that are becoming more frequent over time, or that are severe enough to disrupt your sleep regularly, are the pattern that matters clinically and are worth bringing to your doctor directly. Third, review your medications and habits with fresh eyes. Are you taking a diuretic, a statin, or any new medication around the time the cramp started? Has your activity level changed recently, either becoming much more sedentary or unusually intense? Are you drinking noticeably less water than you used to, especially in hot weather? These are not things your doctor can guess. They are things only you can notice and report. Fourth, notice what happens around the cramp itself. Is the area normal afterward, or does it stay swollen, warm, red, or tender for hours or days after the cramp has passed? This distinction matters enormously, and we will come back to it directly in a moment, because it is one of the most important safety points in this entire video. If you have noticed this pattern in your own life, write one word in the comments. Yes. Not your private medical details, just yes. It helps us understand how many people are quietly dealing with this and never talking about it. It also helps to notice whether the pattern is stable or changing. Occasional cramps that have come and gone for years, without ever getting noticeably worse, are a very different clinical picture than cramps that have clearly increased in frequency or intensity over the last few months, or that started suddenly around the same time as a new medication, a change in activity level, or an illness. A steady, lifelong pattern is often simply an individual tendency toward cramping. A pattern that is clearly new or worsening deserves a more focused conversation with your doctor, not because it is automatically dangerous, but because change itself is the signal worth investigating. A simple habit that can genuinely help here is keeping a brief cramp log for 2 or 3 weeks. Note the time of night, which muscle was involved, how long it lasted, and anything unusual you did that day, like unusual exercise, alcohol, or a new me. Dication. Thoughtful. This turns a frustrating, seemingly random experience into something with an identifiable pattern, which is exactly what helps a doctor connect the dots quickly. Let's walk through a realistic example because abstract mechanisms are easier to understand with a real scenario attached to them. Picture a 64-year-old man who has been getting calf cramps 3 or 4 nights a week for the past few months. He assumed it was simply dehydration, so he started drinking more water, but the cramps continued. He also mentioned, almost as an afterthought, that his doctor had recently started him on a new diuretic for his blood pressure, and that he had been sitting at a desk far more than usual since retiring. Surprised individually, none of these facts seemed connected to him. But together, they describe a pattern that points toward a medication-related electrolyte shift combined with a newly sedentary lifestyle, both of which are common, both of which are manageable once identified, and neither of which he would have mentioned to his doctor if he had not learned to notice the pattern as a whole, instead of assuming it was simply age. This is not about turning ordinary aging into a source of fear. It is about learning to describe what your body is doing with enough precision that a doctor can actually help you. Most people describe symptoms vaguely. I just get cramps sometimes. A vague description leads to a vague response. A specific description leads to a specific answer. Now, here are the situations where this stops being something to simply observe and becomes something that needs medical attention without delay. This is genuinely the most important part of this video, so listen carefully. A true muscle cramp resolves, and afterward, the leg generally returns to normal, aside from some temporary soreness. If instead you notice new swelling in one calf that does not go away, especially with warmth, redness, or tenderness to the touch, that is not the pattern of an ordinary cramp. Serious. That combination can indicate a blood clot in the leg, a condition called deep vein thrombosis, and it requires prompt medical evaluation because in some cases a clot can travel to the lungs and become a medical emergency. If you notice sudden shortness of breath or chest pain alongside leg swelling, seek emergency care immediately. If cramping is accompanied by visible muscle weakness, noticeable muscle wasting, or persistent twitching under the skin that does not resolve, that combination deserves a dedicated neurological evaluation because it points towards something beyond an ordinary nocturnal cramp. And if leg pain consistently appears specifically during walking and eases with rest, that pattern deserves evaluation for circulation issues rather than being treated as a typical night cramp. Urgent. These are red flags, and red flags always come first, before any explanation of mechanism, because your safety matters more than understanding the science behind it. For everyone else, the everyday version of this story, here is the honest, non-dramatic truth. Nighttime leg cramps are extremely common, especially after 50, and in the large majority of cases they are not a sign of a serious underlying disease. But that does not mean they should simply be endured indefinitely without ever asking why they are happening, especially if they are frequent enough to disrupt your sleep regularly. Clinical experience shows this pattern repeatedly. Identifiable, fixable contributors like medication timing, hydration, activity level, and simple stretching habits are present in a meaningful number of cases, and addressing them can significantly reduce how often cramps occur. This does not diagnose disease by itself. This video cannot and should not replace an actual evaluation from your doctor, but it can help you walk into that appointment prepared with specific observations instead of a vague complaint. Instead of simply saying, "I keep getting leg cramps," you can now say, "I'm getting calf cramps 3 or 4 nights a week. I take a diuretic for my blood pressure, and I sit most of the day." Encouraging. That single sentence gives your doctor far more useful information than most patients ever provide, and it dramatically increases the chance of an efficient, accurate evaluation. When patients report this pattern to doctors, the common evaluation often includes a review of current medications, blood tests to check electrolytes, kidney function, and thyroid levels, and a simple physical exam checking for swelling, pulses, and reflexes in the legs. In some cases, if the pattern or exam suggests it, further nerve or circulation testing may be recommended. None of this is complicated. None of this is invasive. Reassuring, it is simply the process of finding the actual contributors behind the symptom instead of assuming it is just aging or just cramps. There are also simple, doctor-approved habits that can genuinely help without replacing medical care. Gently stretching your calf muscles before bed, holding each stretch for 20 to 30 seconds, has been specifically recommended by physicians as one of the most effective preventive habits. Staying consistently hydrated throughout the day, rather than drinking large amounts all at once, supports the fluid balance your muscles depend on. Light activity, even a short walk after dinner, appears to meaningfully reduce cramp frequency by keeping circulation and muscle function active rather than sedentary. Reviewing your medications with your doctor, specifically asking about diuretics and statins, can identify an easily adjustable contributor. And loosening tight bedding around your feet, since some people find that pointed toes under tight sheets can trigger a calf cramp during sleep, is a small, low-effort change worth trying. None of these habits are a guarantee. None of them are a cure for everyone, but research and clinical experience both suggest they can meaningfully reduce how often cramps occur for many people, especially when the underlying contributors involve activity level, hydration, or medication timing rather than a more significant medical condition. Some doctors also recommend simply avoiding sleeping with your toes pointed downward, since that position shortens the calf muscle and can make it more prone to cramping overnight. Curious. If a cramp does happen, the immediate response matters too. Gently flexing your foot upward, pulling your toes back toward your shin, directly stretches the cramping calf muscle and often brings relief within moments. Standing up and putting gentle weight on the affected leg can help as well. Massaging the muscle and applying a warm compress afterward can ease the lingering soreness that often follows. None of this needs to be complicated or require any special equipment, and having this response ready before a cramp happens can meaningfully shorten how long it lasts. Let's bring this back to where we started. You wake up with your calf locked into a painful knot again, and you assume it is just a cramp, just your age, just something to live with. But now you understand what is actually happening underneath that moment. Tendons that have quietly stiffened over the years, nerves that fire slightly less predictably during deep sleep, hydration, medication, or activity patterns that have shifted the balance your muscles depend on, or, in less common cases, a circulation or nerve issue quietly asking for attention. That is the real reversal here. The symptom is visible and painful. The underlying cause is very often hidden and fixable. Small sign, identifiable mechanism. The body changed, but the explanation most people were given never changed with it. You do not need to panic about this, but you also should not dismiss it. If this is a pattern you recognize in your own life, or in the life of someone you love, the next step is simple. Mention it to your doctor, specifically, clearly, and with the observations we just walked through together. If this helped you understand your body more clearly, subscribe to Dr. Michael Carter, tap like, and write your city in the comments. Your comments genuinely help shape the next videos we create, and they help us understand which patterns are affecting the most people watching this channel. This video is for educational purposes only and is not medical advice. Always talk to your doctor before changing any medication, supplement, diet, or exercise routine. and before making any decisions based on what you learned here today. Take this information, bring it to your next appointment, and use it to ask better questions. That is exactly what this channel is here for, and it is exactly why understanding the mechanism behind a symptom matters just as much as noticing the symptom itself.